I think the first message to convey to the community is that the health sector remains open for patient care, and so if you have any physical or psychological issues that need dealing with, then we are open to help you. And that should take its usual pathway of seeing either your GP or pre-existing specialists, and then organising a consultation if necessary, and that may be done via telehealth. So essentially, if you've got a breast symptom, you should still, if it's a persisting new problem, present to your GP, and that may be via a telephone consult to get it further investigated. And when I say symptom, I typically mean if you've got a new lump, if you've got any skin changes, for example, if there's dimpling or a contour change, particularly if you lift your arms up, you may only notice it at those times. Or for example, if you've got a watery or a single duct, nipple duct leaking fluid, that's not normal and that will need to be investigated. Another sign may be nipple retraction. And we're particularly concerned about the older women, particularly the over 50s. About 3/4 of breast cancers are in women who are over 50, but that's not to say that younger women can still get breast cancer, but it's a less common scenario. Most young women who get a breast symptom, thankfully, it's actually a benign change. So your GP will organise that in the usual way and send a referral through. And as a surgical group, we are open to receive these referrals, and we will typically look at your imaging online, or if need be, we'll get you in and assess you formally to establish what further tests you need and follow up from there. So your GP will make a referral, and it may be that we can do a telehealth consultation, talk to you over the phone, and we thankfully can review a lot of imaging online and even organise biopsies without actually meeting you. But if we need to see you and take things further, then we'll also do that, because it may be that you need treatment for a breast cancer. Well, typically your GP will guide you if some things can be deferred. So some symptoms may not be that serious and you may be able to defer your imaging. But on the other hand, sometimes imaging is the key to determine whether you have a serious problem or not. Oh, absolutely. So radiology services still remain open, and you'll have appropriate imaging with typically mammography, digital mammography, and targeted ultrasound, and other tests may be required. So yes, you will have tests. It is safe for you to be in hospital. As I said, we take a lot of precautions with hygiene within the hospital. But for most breast cancer cases, it's often an overnight stay, and so you're discharged relatively quickly. It's low-risk surgery, and typically you'll be able to get home. For those patients who might need a drain, they have slightly larger surgery, then we often discharge home with a drain tube in place if their home environment is suitable. Every breast cancer patient's care is carefully planned along with a team of other doctors, which include oncologists, radiation oncologists and other healthcare workers, and we'll tailor your treatment pathway according to your personal factors, as well as the tumour biology and the volume of your disease. You should absolutely get on with your cancer treatment now, and in terms of scheduling of treatment, it could be that you have drugs therapy first, followed by surgery and reconstruction. Yeah, absolutely. I mean, there are some women who are high-risk gene carriers that may have a BRCA1 or 2 gene, and naturally they will be more anxious about not having screening imaging. And I think we can make exceptions for this group to have their annual imaging, perhaps with just a single modality like an MRI scan. So most patients in that predicament are under the care of a number of specialists or a single specialist or their GP, and we'll have a plan in place for further ongoing surveillance. So certainly for many of those ladies, they'll be having annual imaging, and if there are no new concerns, and again, I think it's safe to defer that for a number of months. Having said that, if there are any new symptoms that are worrying, then of course imaging can be done and issues can be dealt with accordingly. And likewise, if patients have symptoms and they might need modification of their medications, then that can be discussed, usually over a telephone or teleconsult. So we will continue to look after our patients. So typically we would get your consent and then go on to organise either a phone call or a video conference with you after reviewing your referral and reviewing all your imaging. And then we make an assessment over the phone or over the video as to what further investigations or actions are required. So we're still offering surgery, urgent surgery in all hospitals in Victoria, and I operate at Cabrini, Brighton, and we are still doing urgent cases for the time being at the hospital.
When you're diagnosed with breast cancer, your case will be taken by your surgeon to a multidisciplinary meeting. Cabrini has multidisciplinary meetings for all tumour streams, not just breast cancer. There will be medical oncologists, radiation oncologists, pathologists, radiologists, surgeons, breast care nurses, and a myriad of other people at the meeting. Your treatment plan will be determined there, and you will subsequently be referred by your surgeon to whoever is necessary for you. Not at all. The only thing that has changed is that we now use telehealth or Zoom, which most people have probably heard of now, meetings. So no one actually attends the meeting in person, but the meeting carries on exactly the same. There is some evidence, although it is changing, that there is more risk to people who are on chemotherapy when they get COVID-19. In terms of your ability to be infected, that is no different from the normal population. The good thing about the chemotherapy we use for solid tumours, including breast cancer, is that the immune abnormalities are very temporary and return to normal very quickly. We have ways of boosting your immune system, particularly using certain injections, and they will definitely be used during your chemotherapy. Absolutely not. The problem that we face is we do not know when this crisis will end, and we do know that if people delay therapy for a significant period of time, their outcome is worse. At this point in time, there has been no significant problems at Cabrini with regards to treatment of patients with chemotherapy. We have strict guidelines around patient entry into the hospital, around the number of relatives or guests that can attend chemotherapy and can attend consultations. We use telehealth wherever we can, and we are doing all we can to boost immune systems of patients that require necessary chemotherapy. It is recommended by all levels of government and medical organisations that your appointments are now done by telehealth. So you will go to have your routine investigations and you will speak to your doctor over the phone or on Skype or some other form of communication. The investigations will be organised by the staff of your doctors. The reality is we can organise everything without you actually coming to the hospital. You will need to go to the hospital to have blood tests, scans, those type of things, but the doctors will review those prior to speaking to you on the phone. I have a couple of things that I want to say. The first one is that you must not stop your treatment. Your treatment is important to your eventual outcome and gives you a better chance of being cured. The second thing I want to say is we have no idea when this crisis will finish, but the government so far has done an extremely good job. That has been done through two things: social isolation and stringent hand washing. From that point of view, you must continue to do that, and people cannot become lax despite the fact that it appears that the numbers are reducing. The numbers are reducing because of the things that the government has introduced. That will reduce your risk of developing COVID-19 while you're on treatment.